We are applying local anesthetic now. Have to do it on the every teeth and every lower mucosa muscle. I will make an incision through the mucosa with electrocautery pen so that we can unveil the jaw. We'll carry on the incisions of the mucosal layer in the anterior region, outer way of the lip. We can already see the mouth muscles right now, the jaw muscles right now. We will now incise the mentalis muscle near the alveolar bone ridge. This muscle is called mentalis muscle. Have to do it finely, and now we will elevate the mucoperispecial flap to expose the fracture. The fracture is right around here, just here. You can see the fracture now, how deep it is. Probably has fall down on his face or something like that. It is not that much common, but it happens every now and a while. We will apply some kind of plates here. We will reduce the fracture with pointed reduction forces. I mean, pull them closely. That's why to make 2 points and then pull it closely. We will now select and contour a 6-hole 1.5 mm matrix plate to the bone anatomy. And contour means just align it to the bone. We will now apply it to the lower border of the symphysial region of the mandible. We insert a locking drill guide during the next roll of the fracture. We'll measure the required length. Just have to put the screw properly because this is the most important part, right? Now to the other part. As we have done with the reduction, we will now tighten the screw and apply the same process on the other 4 holes in the same manner. We will close the wound in a layered fashion and remove the MMF. Just applying the sutures, absorbable sutures, of course monofilament probably. Now there should be an incision right below the ear, right around here. We'll insert the skin and the subcutaneous tissue here. We'll bluntly undermine the skin and subcutaneous tissue further anteriorly and superiorly for better exposure and access. The jaw is also broken here. We will make a vertical incision through the patellar fascia and dissect it. We'll bluntly dissect and widen this opening into using a parotid gland. You can see the muscle. Now we have to insert some masseter muscle to expose the posterior border of the mandible. This muscle is called masseter muscle. We'll continue the dissection further superiorly along the posterior border to expose the condylinar process and the fracture. We'll now manipulate the condylar process and convert into lateral override situation. I mean, the broken bone is there, so we'll just pulling it properly and then we'll apply the same kind of plates around here. The same kind of plates around here. We'll adapt and apply a 4-hole 1.00 mm thick matrix mandible manipulate to the lateral surface of the mandibular arms along the posterior border. You can see we are doing the same thing that we have been done. We'll now rotate the jaw to see if everything is okay. We'll align the posterior border of the ramus by applying full traction in the plate to achieve reduction. So the plate doesn't obstruct any kind of face movement, you know. We'll properly apply traction to the plate. We are doing here with the two plates right now. We'll insert another 6 mm long 2.0 mm non-locking screw here. And we'll fill all the remaining plate holes in the same manner. Now for the next part, we should just go to this fracture. We'll do a local anesthetic here, only fast towards it. Here is the upper jaw that we are doing right now. This is also called maxillary approach. You can see the crack there, right? Now for the eye part, we'll just tie the upper and the lower eyelid, and also for protecting the eye we did that. You can see the fracture, right? This face had a grave injury. It often happens in a bike accident of some kind. The face is just like fucking shattered. You have to cut it in proper places and then adjust it. And apply screw as I suggest. There is bleeding happening. We have to check for hemostasis there. And for closing the hemostasis, we should use electrocautery pen, obviously. Have to close it all. This is time for the wound closure. Applying local anesthetic again. This is at 3:28 am. In 7th, how can I even prove that? We should proceed cautiously here because every bone is like shattered right around here. It's time for phase 6. We will apply the plate to the fracture between the nasal bone and the frontal process of the maxilla and fix the plate with 1.5 mm screws. It is so pain in the ass, like you have iron screws in your whole body. And to verify the reduction also. We'll close the laceration and subciliary wounds layer by layer with reservable 5.0 sutures, right? Now it's time to crack open the brain. Anyway guys, this is the end of the stream. We are going and goodbye.